It's so wonderful to have you and to have had you over the past several years.
Well, Erica and Ben, it's really great to be here with you. Good afternoon.
I do want to tell you, before we get started with the questions, you've been such a calm, reassuring voice through what for a lot of people was a very anxious time. So we do really appreciate all your guidance over the last 3 years.
Well, thank you very much. It's really been a pleasure doing it, and really, I think, an obligation to help the public understand what's going on.
So let's talk about where we are now. We couldn't have done this 3 years ago, of course, when all this was still very much unfolding. But now we're finally in the same room face to face. What do you think our infection risk is truly today for most healthy, vaccinated people?
I think it's really very low nowadays. I mean, even I've stopped wearing a mask when I go to the symphony, or I was on an airplane yesterday and I didn't wear a mask. I think we can be really comfortable, especially if you don't have any other specific risks, like you're not an immunocompromised person, that the risk of acquiring COVID now is quite low.
Well, earlier this spring, the White House, I guess, asked about a dozen health experts, what they thought about a highly mutated variant like Omicron really posing a risk in the next 2 years. And I guess the number they gave was about 10 or 20% thought that could be the case. What are your thoughts on that?
I think it is anybody's guess. It is certainly still possible that we could have some completely new variant, another Greek letter pop up that would be highly contagious. But I think we have enough immunity now that we would be protected against severe disease, even if a lot of people came down with an upper respiratory infection.
We heard you many times, especially early on, say COVID is not the flu. It was much more deadly, especially in those earlier waves, much more deadly. But now we have vaccines, we have various treatments. We know a lot more about this illness. So has your opinion changed about the risk it presents to all of us?
I think it's still a different virus than influenza, and not to minimize the severity of influenza, which for some people can be quite deadly. I think it is going to be a different virus from now on into the future, and we should still think about it separately from influenza.
Well, and looking at a snapshot in time, you are the chief of infectious diseases at the Brigham. At the Brigham, how are things? You mentioned no one in the ICU with COVID.
That's really so terrific to see that we don't have critically ill people with COVID. We do still have about 10 or so people who tested positive, maybe 1 or 2 are in the hospital because of COVID, but it's really been continuously decreasing over the last several months.
And I want to ask you one more thing while we have you here. So we both have school-age children. I know you have school-age grandchildren, you have adult children. When do you advise folks get out that COVID test and swab? Because, kids, especially this time of the year, allergies, runny noses, do you really need to be doing it every time your kid has a cough or a runny nose?
Yeah, that's a really tough question. I think we're going to have to wait and see what's happening and get some guidance from the CDC about when is the right time to test. Because you're right, much of what we're seeing now is really not COVID, and why would you be testing all the time?
Okay.
Okay.
Good advice.
Dr. Kritzkis, so good to have you.
Great
Thanks
to see
again
you.
so much.
Thanks for coming in.
You're very welcome.
Nice to shake your hand. We appreciate it.